Dr. Andy here today. I want to introduce you to how we combine radial and focused shockwave in the office. As you know, we have now introduced both types of shockwave in the office, and if you watched our previous video, you learned that this is really effective. It's what we've had for a while now. You know, it's extremely effective for about 95% of cases. Our focus machine is going to help us pick up a couple extra cases that we weren't previously able to treat. But really the big reason that we brought it on is because it elevates the game. When you combine both pieces of technology, you actually get way better results, okay? So I want to explain to you how we integrate them and how we use both typically with our care in the office, okay? So radial is best with bigger muscle bellies, all right? Sometimes some people might describe that it's a little bit more uncomfortable. It's a little bit more slappy. It kind of feels like maybe you're getting hit with a elastic band, maybe a paintball gun. Anyways, the radial it's a little bit better, as I was saying, for muscle bellies, bigger muscle bellies. So if we're talking about, just for an example today, we're going to talk about lateral epicondylitis, which is tennis elbow, which we see a ton of tennis elbow in my office, okay? So I want to show you, just kind of demonstrate, a little bit about how we're able to differentiate and where we use each of our systems, okay? So the tendon and all of the damage and where we feel most of our pain is up here, where muscle belly leads into the tendon and then attaches to the bone, to the lateral epicondyle, okay? And we feel most of our pain right through here. Now, if the only thing you do is treat right through here, you're actually going to miss a lot of the muscle spasms and trigger points through the muscle belly as well, okay? So this is where radial comes in. Radial is really good at breaking up the muscle spasms and helping to heal this area in the muscle belly itself, okay? So we want to get through here, we want to build some stem cells, break down the damaged tissue, bring in some stem cells. We're going to be using it primarily right through here for the muscle belly. Let's just, really quick example, you got a quad strain, right? So big meaty part of the quad, that's where we're going to use the radial, and then we'll use the focus on the patella and up more closer towards the hip, okay? Where the muscle is attaching to the bone, that's the tendon, okay? So right through the big muscle belly is what's really effective for radial. And then we use focus to do a lot more of the spot treatment, right? So it's really effective. It's going to get a little deeper. It's going to hit those tendons right exactly where we want, and it does a lot better in terms of getting good results with the tendon as opposed to the big, huge muscle belly, okay? So after we do this treatment, then, we'll split the time 50% of the time here, 50% of the time here. And this is when we're going to bring in the focus. We're going to find that lateral epicondyle, we're going to find that tendon, and this is where we're going to be focusing most of the focus shockwave right through here, okay? Again, if we're talking about the quad strain, that's going to be more around the patella or up closer towards the hips, okay? So the focused is going to be much more effective for the spot treatment, the little tiny trigger points that we might get in the tendon, for the tendinopathy, and then the radial is going to be a lot better for the big muscle belly as well. Could the radial do that before as well? Absolutely. This is just a little bit better. And for my patients, I want them to get the best. Okay, so when you combine both of these treatments, you get incredibly good results. All right, so if you have any questions, send them my way. And always remember, live with passion, not pain.